Hi, folks.
Hello.
Welcome to our timeline, health and longevity, Ask Me Anything with Dr. Anurag Singh here on my left, who I'll introduce in just a second. We're here in Switzerland at the Swiss Federal Technology Institute, the EPFL University, which, as many of you know, is where the company was born. And I'm very excited to thank you for taking the time today to learn more about timeline, about MitoPure, UrthA, longevity in general. So a couple of administrative things before I introduce Dr. Anurag Singh. So you have a live chat function there on your right. So feel free to pop in any questions and we'll do our best to answer as many of those as we can. And we also have, thank you to everyone who submitted questions ahead of time. We have over 60 questions that were submitted, and we'll do our best to get through as many of these as we can. So Timeline, as you know, we're a Swiss biotech focused on longevity, and Anurag will tell you a little bit more about it as he answers some of these questions. So we were founded here at the EPFL University over 15 years ago now. We're celebrating our 15th anniversary this year. Very excited to tell you more about our work on cellular health and longevity. A quick disclaimer, so Dr. Anurag Singh, while he is a phenomenal doctor, he is not my doctor nor your doctor, so please make sure you take this as for educational purposes only, and make sure you consult with your personal doctor and family physician for any questions. So Dr. Anurag Singh is he's a very unique member of our team. He's the Chief Medical Officer, and he's been with the company for over 8 years. He's a medical doctor, but also a PhD. So Dr. Singh did his medical degree in internal medicine at the Armed Forces in India. And after doing that for 7.5 years, he decided that wasn't enough. So he decided to go do a PhD in immunology at the University of Connecticut. So welcome, Dr. Singh.
Yeah, pleasure.
Thank you for joining us. So I'd like to start this question. We did this a few weeks ago on one of these. So why do a PhD after 7.5 years of MD? That wasn't enough for you?
Well, no. So traditionally, the path available to a lot of clinicians is to, basically do your MD, do your residency, do your fellowship, and then train in that one niche specialty that, you're going to be seeing the same kind of conditions all your career. So that was not clearly enough, because I was always intrigued that modern medicine is really taking and addressing the symptomatology, right? So it's really trying to not look at the root cause of why certain chronic conditions happening, or aging, which is the biggest chronic condition, is happening. And so I started looking at how the immune system is aging as we all age. And so that got me interested in doing a PhD in immunology and being a physician scientist.
Fantastic. Great. Well, with that, let's jump in. So the first question I have here is there's a big article that came out yesterday with a doctor in the US, a well-known doctor in the US, naming his top 5 supplements and interventions in this longevity space, anti-aging space. And UrthA was number 1 on the list. What are your thoughts on that?
Well, so this is 15 years of really hardcore science and clinical evidence that we have put behind really starting with this whole idea of getting the biotech approach to nutrition, and really discovering new natural products that are safe and are scientifically and clinically proven. So I think it's just a recognition of the years of hard work and randomized trials that we have done to elevate the how I say, the playing field for new natural compounds to get to the recognition from the medical and scientific community. So very happy to hear and see that.
Great. So some of the other names on their list, some of the usual suspects were, rapamycin, NR, NMN. I believe metformin may have been on the list as well. How does UrthA compare to some of these others? And a lot of the questions we have here from the audience are, should I be taking multiple of these? Should I be taking just one of these?
Yeah, so essentially the whole longevity field everybody has their own favorites, right? So if somebody prefers metformin, well, metformin makes sense because it's a drug out there for the last 30 years given to diabetics to lower their sort of glucose responses. And so it's a safe drug, but again, it's a drug that now people are positioning to see other benefits. Now, a lot of excitement in the field about other nutritional actives, such as you mentioned about NAD or NMN. Now, you can really improve mitochondria through three ways. One, you can make mitochondria be more efficient. So that's where a lot of things like CoQ10, from what I heard from you, or metformin fit in. They are making your mitochondria, existing pool of healthy mitochondria, function better. Then there's the other mode of action, which is create newer healthy mitochondria. And that's where a lot of NAD boosters or even resveratrol, for example, work, that they help in creating new mitochondria. What makes urolithin very unique is it hits a totally different pathway of improving mitochondrial health, and that's called mitophagy, which essentially means as we age, as our metabolic demands with aging are changing and our cells are accumulating a lot of faulty mitochondria, the process of cleaning this waste slows down. And what urolithin does phenomenally well is it activates mitophagy, which means all these faulty mitochondria with eat me signals now get pulled into a trash bag and cleaned out, and that gives a lot of room for newer healthy mitochondria to come in. And that's how it's so unique and so different than the other actives out there.
So it's like a mitochondrial Pac-Man.
It is. In fact, that's what I often say. It's a mitochondrial Pac-Man, or like your neighborhood trash, garbage truck, which comes in and takes your waste away, and then that leaves your house or your cells, in that analogy, doing the right things and having great cellular health.
Okay. And on that point, I mean, one of the questions from the audience is, can you stimulate too much mitophagy? Is there such a thing?
So the mitochondria and different cell types have different levels of mitochondria. So for example, the more metabolically active organs like the skeletal muscle, the brain, the cardiac cells, these have thousands of mitochondria. And so they are in this constant flux, as I say, of balance between healthy and unhealthy mitochondria, and that's the balance between biogenesis and mitophagy. Now, once you do, if you accumulate a lot of stress in your mitochondria, then now you have shifted the balance to in favor of more unhealthy mitochondria. That's where urolithin comes in. It cleans, as I mentioned, the waste out. Now biogenesis comes in, and you have more of a healthy setup of mitochondria. You can't really overstimulate the mitophagy, because you only have a certain proportion of your mitochondria that have this eat me signal put up on their to be taken out of the trash bin. Now, once that process is enabled, these then become the building blocks of newer healthy mitochondria to come in. So what we see in a lot of, and others, other top scientists see, is that mitophagy comes first, and that leaves way down the road to biogenesis. So if you stimulate mitophagy, you give way to biogenesis, and this is like a cyclical process.
Okay. Super. So maybe shifting gears, a couple of questions from the live audience here.
Mm-hmm.
So we have a question from Kay. Is this okay for cancer because of antioxidants being seen as pro-oxidant, or too stimulating for growth factors?
So this is a common, let's say, misconception that, urolithin is an antioxidant. The main role of urolithin, from what we are seeing, is that yes, there are some studies out there that show it's had antioxidant benefits, but its primary mode of action is through a mitophagy activation, meaning that it cleans the waste out, as I've been saying before. Now, can that be sort of, in certain contexts like cancer, be challenging? So we've actually gone, and a lot of our collaborators have been studying what is the exact role of urolithin given in different cancer models, like colorectal cancer.
These are preclinical models.
These are, of course, preclinical models. We have not done the randomized trials yet. So what is coming out is that a lot of what we call the effector immune cells, so these are the immune cells that are fighting the cancer cells away, their mitochondria get hijacked by the cancer cells, and their mitochondria accumulate a lot of mitophagy. So what you have is basically a very ineffective immune system. And so what they're finding by giving supplementation with urolithin, you activate mitophagy in these what I call the supercharged T cells, and they clean out the cancer. And in other spectrums, A lot of people recover from cancer today. You know, the standard of care has risen, but you go through such a exhaustive protocol of let's say what we call standard of care, which is chemo, radio, therapy, that it essentially knocks away all your immune system. And so even in that setting, what we are seeing, our collaborators are seeing that in these models of immune exhaustion, giving urolithin boost the stem cells to differentiate better into newer healthy immune cells, and that actually helps in getting a very sustained immune system fast after recovering from cancer. So yeah, that's where a lot of our efforts are actually focused on today.
But maybe just a clarification, we're not recommending urolithin to prevent or cure cancer.
No, not
That's
at all.
not what this was intended, or our work is intended to do, right?
Yeah, exactly. These are models. So what we are doing now is to really translate this. What does it mean for healthy folks like you and me? And
how do we keep our immune system?
How do we keep, especially in these times, it's cold, winter, everybody's catching, you know, some sort of viral illness. What does that mean to keep your immune cells? It's a lot of, whether it's cancer or viral exposure or autoimmunity, these are really sort of exhaustive on our immune cells, and the immune cells, mitochondria, kind of lose energy and they become tired. And so what we're trying to do is, in the healthy context, folks like you and me, by giving urolithin, can we make the mitochondria of immune cells like T cells and B cells have more energy to fight these sort of environmental stimuli away?
Okay, super.
Yeah.
Another one from the audience here, just from James. So any chance MitoPure might be interacting with heart medication in an elderly 96-year-old? So maybe speak a little bit to statins, and we often get this question.
Sure. So statins are traditionally known to be mitochondrial toxins. So they if you have been on a statin, in about 30 to 40% of the patients, what we know in the medical community is that your mitochondria will be dysfunctional, right? And that's why a lot of folks get muscle problems being on certain older generation of statins. Now, can you take it with these other medications that old people are taking? Yes, you can. And so what we have done actually in all our randomized trials, in fact, all the initial trials were done in older adults who were polymedicated. So they were taking antihypertensives, they were taking all kinds of vitamins and minerals. Some of them were taking statins, and the effects that we saw was really above that, and there was no interactions in those healthy. Now, of course, if you have other chronic conditions, that's where you need to be discussing this with your doctor.
So to summarize, we didn't see any, compared to the placebo group, we didn't see any adverse effects, no side effects.
We saw no side effects that were different from the placebo group, and we saw the benefits above what the portion of people taking placebo or the active urolithin were, and so that's the data we have today.
Okay, super. Yeah. And so a lot of questions here from the group, just going to pre-questions around, if you could speak maybe a little bit to dosing, what time of day, what dose should I be taking? Should I be taking it for 2 months? Should I be taking it for 4 months? Should I be staying for longer? What are your thoughts on that?
So one thing I always say is, folks, this is not a magic pill, right? You need to be on it to enable to start mitophagy and then see biogenesis. So in our earlier trials, what we saw was it takes about a month to get this sort of impact on improving your cellular and mitochondrial health. And then about 2 to 4 months in, what you get is you start seeing these benefits on aerobic endurance benefits. You start seeing better leg strength and lower inflammation. So on the dosing side, we see that about 500 milligrams of urolithin MitoPure is where you start to trigger the mitophagy and the biogenesis from happening, okay? And the same, as you increase the dose, you start seeing it happen much faster, in a faster time scale. Now, when we go longer, in about 2 to 4 months, the effects at a muscle level of 500 or a gram are very similar. You see similar effects on, for example, leg strength. We see both 500 and a gram being about the same. 1 gram is a bit better in terms of looking at other cellular health markers linked to inflammation. So we see better immune health, lower inflammation in older adults and even middle-aged adults who have been taking the higher dose of urolithin. So this is what I recommend. You need to take the product for at least 2 months, right, to see the benefits on things like muscle health and mobility. But if you go longer and if you feel your body is inflamed, for example, you can always up the dose, and that's what my recommendation is. So 500 milligram is the beneficial dose. But if you do feel you need a bit more energy, if you do feel you need to fight some inflammation that your body is suffering, then you can up the dose to the gram.
So that's a great segue to the next question. A lot of questions from the group around, you've talked a lot about the mitochondrial mechanism of action.
Yeah.
You mentioned briefly the anti-inflammatory. Maybe we can go into sort of the inflammation piece a little bit more, but questions from the audience here around Crohn's disease, also cardiovascular, potential benefits for heart health, potential benefits for bone health. I can't help, I wonder, it's starting to sound like this is a miracle, a miracle in the sense that why is it able to potentially, and obviously clinical studies pending, but potentially why would it have all of these downstream impacts?
The answer lies in our mitochondria, right? So every cell in our body except the red blood cell has a lot of mitochondria. So the more metabolic the organ, the more mitochondria you have, the more this will have an impact. So we have run, of course, as Federico was saying, clinical trials to look at a lot of improvement in muscle health. Now, a skeletal muscle cell is the most metabolically active cell. It has thousands of mitochondria that are always getting damaged, and then they're going through the cycle I was describing. And so that's why we started looking at muscle health, because we saw these great benefits on that. Now we've gone in and looked at skin cells, for example, that also have hundreds of mitochondria and that are implicated in collagen synthesis, for example, and we see effects there. And now we are looking at immune cells. But it's not just us, the science is really going at a very fast scale. Today, top scientists, clinicians are looking at the impact of UrthA, MitoPure on, for example, how does the pancreatic cell produce insulin, for example, or how does the neuron cell that in older sort of models of neurodegeneration or cognitive decline is having an impact. So the answer lies, the mechanism of action remains the same in all these cell types, which is mitophagy and then improving mitochondrial health.
And what are your thoughts? I mean, a lot of questions in the audience ahead of time here around brain health and the potential benefits. I mean, how does this compare to other supplements like those from brands like Novos and Tally? Is it hitting on just one hallmark of aging? Is it hitting on multiple hallmarks of aging?
These are a great set of questions. Now, I can speak about, from the 15 years we've done is that we've focused on this, really identifying this one nutrient and really identifying which key hallmark of aging it hits, and we found that it's mitochondrial dysfunction. Now, what I think this key hallmark of aging, mitochondrial dysfunction, does, it's probably the central pillar on which the other hallmarks of aging rest. And so we see chronic inflammation, which is a new hallmark of aging. We see better organelles, better cellular organelles interaction, as we look in deeper into the cell types. And so I think we are hitting on multiple hallmarks of aging through this nutrient. Now, you said, how does this compare to some other products out there in the longevity space that basically take the philosophy of combining multiple ingredients? Now, these are not really looking at the finished product and all the different things they're putting and running randomized trials. They're looking at, for example, Tally Health has UrthA also, if I'm not wrong, and they kind of use the data that we have. But again, that's why what makes us very different is that we have a very focused approach on science being the pillar, the foundation, elevating the whole game of nutrition science, publishing in top peer-reviewed journals, which I think the others are not doing.
Okay, maybe shifting gears a little bit. Lots of exciting questions around skin. So first of all, a question just around, I'm already taking the supplement, the Timeline supplement. Why do I need to also take the topical?
So we got into the skin space, and this is a interesting anecdote, is because when we launched the muscle products and in our trials, some of the folks that were older adults, and they were telling us that our skin health was getting improved. This was, again, anecdotally. A lot of the early adopters of the product started telling us the same. And we thought, well, so this product we know gets into the muscle because we've looked into the muscle. Then we knew that it was getting into the skin from within. But then we said, okay, the other question was, well, people were saying, well, how do I see, or how do I know first thing in the morning that your product is working? And I see that on my face. Do I see that on my skin? And so that got us thinking, well, this is a very robust molecule that can mix well with skin creams, etc. And so we made these products, and what we started seeing was that it was doing the exact same thing on skin cells. It was triggering mitophagy in older skin cells and making them into this re-energized, youthful state. Then we ran multiple randomized trials with the topical product, and you're directly delivering it to the target organ, which is the skin. And so we started seeing these great effects on lowering the wrinkles and improving skin hydration. And when we took skin biopsies, we saw more collagen in the skin. So I think that's sort of where you will see the field, both from a skin and nutrition perspective, is, oh, how can I tackle this, through a dual approach? And that's what makes our approach so unique, is that you can hit or improve skin health from the within through the oral product, and then you can add on to sort of a synergistic approach by putting the topical products and having effects from both sides.
So just to build on that question from Jody here in the audience, is there any data or implications on how UrthA affects collagen formation? I'm specifically asking for someone with EDS, Ehlers-Danlos syndrome. Could MitoPure be beneficial?
So we haven't studied it, of course, in outside the healthy skin and in healthy volunteers. So I can't really comment on that. If there is a dermatological disease, how that would work. But is it, what was the collagen? Yes. So on the collagen, we actually studied this very deeply. We took skin punch biopsies from the forearm, where we applied the product as well, and the control, we did the placebo. Now, what we see in older volunteers is that with age, what you see is basically collagen degradation pathways go up. What that means essentially is that the collagen is getting degraded. The collagen is this protein, basically, that keeps the skin tight, right? And as we age, we are losing about 8 to 10% every 10 years. So you can imagine from your 30s, 40s down to your 60s, 70s, you're really losing this elasticity, and that's what leads to wrinkles. What we saw after 8 weeks of topical application of MitoPure is that we saw these degradation pathways were reversed. So now you have more collagen synthesis happening, which essentially, because people forget that mitochondria are the sites of active collagen synthesis, much as they are of protein synthesis. So that's what we see, actually, is that a lot of these degradation pathways are dampened, and that leads to lower wrinkle formation in the volunteers.
So maybe just because I'm seeing a question here come up again, just around topical versus supplement. I mean, are there advantages to taking both? Do I need to take both, or should I just take one?
So think of skin as a many layered organ, right? So you have the top layer, which we call epidermis, then you have a second layer, dermis, and then you have the deeper, now getting into the connective tissue. So you have many layers of the organ, and skin is the biggest organ. It's about 18% of all the surface area of our body. So what actually, we are still planning to run these trials of the combination, but what happens with oral is that you're penetrating from within, so you're getting the inner layers of the skin nourished with the molecule, and so they're going to be healthy, and their mitochondria are going to be healthy. From the topical, you're really hitting on the topmost layers, the epidermis, which is really the one exposed to all the harmful UV rays, the pollution, and of course they have mitochondria that play. So you're actually hitting from both areas, the top and the bottom. You're nourishing the skin cells, and that's what we see impact both intrinsic and extrinsic skin aging.
Okay, super.
Yeah.
So let's shift gears a little bit to the sort of more the physical activity part of things. So we have a question here from Stuart. I noticed better endurance when taking 1 gram before intensive road cycling. Any benefit to taking it 3 times a week before athletic training? Do you have any data on use by athletes?
So stay tuned, because we've just wrapped a study with probably one of the most prominent researchers in the sports nutrition and sports research field, Professor Lewis Burke in Australia. Now, what we did was we did a study in middle distance and long distance elite athletes. Some of them they even ran the Olympics in Tokyo, and we had to halt our trial for that, but that's a different anecdote. What we see in this setting of where we gave about a month of supplementation is that Mitopure really aided in the recovery and the adaptation. So what you see is athletes have very high inflammation. So you can look at markers such as C-reactive protein and markers of muscle damage, and we see all of them dampened with Mitopure supplementation. And so I think and the adaptation is better, and we even saw benefits above standard training. And in the past, we've published also in experimental models that urtin or Mitopure supplementation is additive to your training regimen. So training plus Mitopure is actually augmenting the same mitochondrial pathway. So yeah, I think it's stay tuned for the publication on our sports trial.
And so a question here prior to the session here, we got a question. What is the best exercise for an 89-year-old woman who is not very active, but able to look after herself with her home without help?
So we have run multiple randomized trials, as I was mentioning, from 20-year-olds who are training for Olympics to.
What did you see in the first trial before an intervention? What was that trial?
Mm-hmm. So the first trial we did was we took 70 to 90-year-olds who were training very regularly for 10 kilometers or half marathons, and we compared them to a group of people who were sedentary, didn't do much of physical activity, and we took small chunks of their muscle with a procedure called muscle biopsy, and we looked through what we call gene sequencing. So that way you can look at 30,000 genes, and what we saw essentially was the top 30 pathways or 30 genes that were all down in the people who were not exercising were linked to mitochondrial health. So these were all linked to different pathways, mitophagy, biogenesis, fatty acid oxidation, but all linked to mitochondrial pathways, suggesting, and then when we compared them to the folks who were exercising, we saw about a 4x or a 6x fold higher mitochondrial abundance and expression of these genes in their muscle, suggesting that exercise is perhaps the easiest modality to have an impact on mitochondrial health, right? Now, what that got us into the second trial, where we took the folks who had the poor mitochondrial health but still were moving around, and we gave them a month long of supplementation, and we could show similar, in 1 month of supplementation, similar benefits of like regular exercise. So my recommendation to an 89-year-old, and we've had 89-year-old volunteers in our trials who, even though were blinded, they swore that it was Mitopure they were taking, and they actually, when we unblinded the study, it was the case. So this, for an 89-year-old, a lot of strength training. You can do 3 times about 20 to 30 minutes every week. You can do strength training and even regular physical activity, gardening, moving around. This has major impacts on improving mitochondrial health. And of course, there's things like Mitopure, so to help or augment that.
Okay, super. So maybe a couple of just easy ones here. What is the optimal time of day to take it? And and then there's also a question on gluten, which we can take after.
Yeah. Well, optimal time of the day, and this is solely because I'm a trialist and a physician scientist. In our clinical studies, we have been giving it to our participants first thing in the morning on an empty fasted state. So that's the best time, because in overnight fasting also helps in autophagy and mitophagy, and that's the whole rationale. Is can we augment that? And so that's how it's worked in real world. And in what I hear is that people are taking it all the time. Some take it in the morning, some split the dose, morning, afternoon. We've actually done another study to look at the effect on the fasted state versus taking it with a breakfast. There's no change in the bioavailability of Mitopure. So yeah, feel free to take it and use it the way it works with your lifestyle. But the most of the trials are done with first thing in the morning.
Is there any difference in the Mitopure? How much is absorbed, of the bioavailability of the soft gels, the capsules versus the powder?
Yeah. So we have done trials on both the soft gels and the powder forms in the berry, and the bioavailability and the exposure from Mitopure in these 2 different product formats is identical. So we see, compared to juice, we've done even a study compared to pomegranate juice, and I see some questions on pomegranate juice or extract coming up. What is the difference in exposure? And it's about 6-fold higher. So if you take 2 pills or 1 berry powder sachet, that's equivalent to like drinking 6 glasses of pomegranate juice.
Mm-hmm. Okay. Question, a couple of more technical questions here, medical questions. So question from Russell, does MitoPure impact liver fibrosis?
So we haven't done the clinical trials on this again, because that would require more of a, that would, the trials we run is in healthy participants. But our collaborator actually is Professor Johan Ulrichs, who's one of the leading gurus in the field of liver and metabolism research, and he has run and shown in different models that urtin A intake for about 8 weeks has, in experimental models of what we call fatty liver disease, has impacts on reducing the amount of fat infiltration into the liver and having better liver function in these models.
So that's a good follow-up question from Carlo here. What about fat cells? Would urtin A be better by improving mitochondrial health of brown fat cells or white fat cells? Liver fat cells.
Yeah, so that, this is another great question, but I think to really say that would require a very high level of clinical trial where we'll have to do liver biopsies and things like this and really look at the impact on mitochondria and these fat cells from the liver. So we haven't got into it. And the experimental side, they have shown effects on improving brown adipose tissue and having better mitochondrial health in burning fat in these models.
Okay. So question from Marcia, how do we volunteer for your clinical trials?
So we run our clinical trials around the world. We run them in the US, Canada, and France, and now we have total almost now 15 randomized trials as we speak. You can look us up on our website, the ongoing clinical studies. You can also go to a very public registry in the US called clinicaltrials.gov, and you can look at all the trials that Timeline Amazentis is doing. And one of the trials actually we are running now is looking also at a test we are developing, and I see some questions on how do I know if my gut microbiome makes urtin or not. So this is a test, this is a trial we actually running where you can drink a glass of juice or a bottle of juice and compare the levels of exposure. You're going to see if you're making the molecule urtin naturally, and then you can try our berry product and see the level of increase you're going to get in terms of exposure to urtin. So look us up on clinicaltrials.gov or on our website, and feel free to write to me as well.
Okay, super. So we've got a couple of ingredient questions. So I can take these. So can I bake the powder into bread? Yes, you can. The amazing thing about this molecule, about MitoPure, is that it is very heat stable, in addition to and also just in general, very, very stable. So you can bake with it. In fact, I've cooked pancakes with it for my kids. Other than turning your pancakes green, there's no other side effects. So it's great. In terms of gluten, if you have gluten intolerance, we have a couple of products for you. The soft gels are gluten-free, so obviously feel free to take those. And then a question around histamine sensitivity, especially with collagen. Any recommendations on that? So we don't have any collagen inside of our supplement products, so that shouldn't be an issue. And again, no issue. There shouldn't be any issue on the soft gels there either. Can we make, question from Kazim, can we make one without gelatin in soft gels? Thank you for the question. That's something that we're exploring further. So stay tuned on that. And then I guess a couple of other questions around, back to you, Dr. Singh. So the questions around just back to how this works and what other things to take it with. There's a question here around, do you personally take it, and would you personally take it with CoQ10, for example?
So I've been taking it for 3 years. I just started doing I was looking at the first clinical evidence. It was so striking that, so I've been on it for 3+ years. Sometimes when I feel like I'm under the weather, or I up the dose, as I was saying, to 1 gram, because I know as an immunologist that's the dose that has the best efficacy. 500 is my staple dose that I take every day. And
So do you take CoQ10? Do you take some of these other things, or vitamin C, or?
So I take well, the thing with vitamin C is you don't know where it goes. You can take a gram of it, but where all it goes. I take personally vitamin D, and I take omega-3 and high protein supplementation. These are my 3 go-to supplementation. With the question on CoQ10, can you take it with CoQ10? Of course you can. As I mentioned, CoQ10 is needed for, it's actually made in the mitochondria, and it's needed for mitochondria to be more efficient at producing energy. So by cleaning, what MitoPure does, it cleans the bad mitochondria out, and then you will get newer, healthy mitochondria inside your cells. And then, of course, you can add that to CoQ10.
Okay. Question from Janet here. I've been taking it 2 capsules a day for 3 to 4 months and haven't noticed any changes. Can I increase the dose, or what are your thoughts in general on this feedback around some people not feeling the benefits, not being able to quantify them?
Yeah, so in a randomized trial, what you get is you get folks, and you put them on a challenge exercise test. For example, you make them go run, or you cycle, and you compare them to what their capacity or endurance or strength was 3 or 4 months back, and that's so in a day-to-day you really have to challenge yourself. So try taking a flight of stairs, and that's where mitochondria is, their energy producer. So you're going to see less fatigue. But you have to challenge this sort of, if you really want to quantify the benefit, I would say try going to the gym for a few days and see if you're recovering better. That's the feedback I hear the most. Oh, I'm less sore today because I feel this is the only thing I changed compared to 1 month back. So try these things, and I think you will. For folks who don't still feel it, I mean, there's a lot of cellular health. Cellular health means your foundation is good, and we can pick up with what we call biomarkers and things like I was mentioning, C-reactive protein. So next time you're at your doctor and he's doing your yearly annual blood work, just try to see if talk to your doctor and see if things have gone better.
Okay, super. So we've got a question from Guillermo here. I had a microtomy surgery in my lumbar for amputations, and I still have nerve pain due to scarring my nerve L5 to 2S1. Would this product help me?
Hypothetically, yes. To really prove that, I would have to, or some of our top clinician advisors would have to run a randomized clinical trial, of course, on this particular condition. But I am assuming.
But it is interesting. Anecdotally, we have had a lot of feedback around pain and on nerve.
So we've actually, that's a good segue, because we were actually with the Scripps Institute in La Jolla in San Diego a few years back. We ran these studies on pain and even joint health and bone health, and it emerged that a lot of problems with these nerve endings or with joint degeneration is linked to autophagy and mitophagy issues in these cell types. And so, yes, at a preclinical level, there is work around this that it can help.
Okay, super. How does alcohol, wine to be exact, affect the mitochondria, if at all?
I know wine has a lot of health benefits associated with it, especially red wine, because it's considered to be rich in certain natural compounds like resveratrol. And long-term wine consumption in moderation, not drinking a whole bottle off, is known to have some health benefits. Alcohol, I guess a little alcohol would stress the mitochondria a little bit, so they may get it, activated to clean the waste out. But again, it
impacts inflammation.
Yeah, it's again about the balance, right? If too much of everything is not good. So I think that's you need to ask the question: is half a glass of wine is okay? Probably is.
Okay.
Yeah.
Okay. And compared to so this is an interesting question from immunity. So compared to other sources of protein, does MitoPure increase muscle more efficiently? So what are your thoughts on?
This is a great question. It's a great scientific question.
How does this compare to protein? What are they doing the same thing? Is this something different?
So traditionally, the whole ideology of high protein is if you're a 60-kilo person, you multiply 60 times a gram of protein. That's your daily intake of protein. So you need to be taking 60 grams of protein. And as you age, you have to up it. You don't multiply it with a multiple of just one. It's 1.2 grams or 1.4 grams. So you have to keep increasing your protein intake. But as we age, we hit what is called a ceiling. So protein, more protein you take doesn't mean you will, it will get metabolized, and that will translate into more muscle mass. And we are, as we age, every 10 years, we're losing 10 to 15% of our muscle mass. So MitoPure is unique in the terms that it will not directly affect muscle mass. It will improve muscle quality. And that means that your mitochondria will give more energy, and it will give energy to help protein get absorbed. So it will aid in protein synthesis. And so we've actually just completing a trial with Professor Stu Phillips in McMaster in Canada, where we have given 20 grams of high protein whey protein supplementation and compared it to 20 grams plus a gram of MitoPure, and trying to see the impact, because already in experimental models we see that MitoPure helps in accelerating protein synthesis rates, which get, as I was mentioned, hit the ceiling with aging. And so if you can break that ceiling,
more gets absorbed,
more protein. And so now you can lower it, and you don't need to give 20 grams. You can actually give 15 grams and get the same effects of 20 grams of protein supplementation. So I think that's some of the exciting science you'll see come out.
So maybe on the protein point, it's interesting. Sometimes there's a gap between the science, what's clinically validated, but also consumer and marketing fundamentally, right? You see all these protein shakes being sold out there, selling you 50 grams of high protein in a single serving. I mean, is more better?
No. In fact, I think it was about a couple of years back, they actually compared 10 grams, 20 grams, all the way to 30, 40 grams of protein supplementation. 10 is great, 20 is great. You get this augmentation effect between doubling the dose of protein. But beyond that, 30, 40 starts being detrimental, and you kind of put stress on organs that are basically cleaning out the excess protein, like kidney, for example, and you start having these impacts on liver and kidney metabolism. So too much of any good thing is also not a good thing.
Okay. So just back to Janet. I'm not sure we fully answered her question. So Janet, we hear you. Can I increase the dose? So if she's taking 500, or if someone's taking 1,000 already, what is the sort of max dose that we've studied? What did we present in our FDA safety dossier?
So we've studied in human trials 2 grams, but
up to 2 grams.
Up to 2 grams, and what we see is that you can improve the level of absorption. So from 500 milligram to a gram, you double the circulating urtin A in your blood, and you can augment the response on improving mitochondrial health and cellular health. That's what we see. When you double it even more to 2 grams, you kind of saturate the absorption, so you don't see that benefit. So that's why what I recommend is, if you're taking 500 milligram and you feel you're not seeing the benefits, yes, please do increase it to a gram, but not beyond that. And if you prefer, you can split the doses of 500. If you have problems taking 4 pills in one go or 2 sachets, you can take 1 in the morning and 1 in the afternoon, for example. But beyond that, we haven't really studied the let's say 2 grams will give you double the effects, and I don't think, because we know the absorption levels.
Okay, super. Just back to the protein point, real quick clarification. We've got Pierre Abid just saying not true, protein is essential. I think maybe that was a misunderstanding. I think Dr. Singh was saying protein is absolutely essential. In fact, even more so as you age.
Yeah, so what I was saying was that you need to have at least, if you're 60 kilos, you need to have 60 grams of protein. And a lot of us don't get enough protein from our daily diet. And so you need to augment with more high protein supplementation. That's why you see companies, and even we have products selling 10 grams or 20 grams of high protein. So yes, you need that. But what is controversial, and not really what Federico and I were discussing, is that if you go beyond that, if you take 30 or 40 grams of excess protein, is that going to keep giving you more higher benefits? The science on that is that no, that's not the answer. So 20 grams is sufficient. Even 10 grams should be sufficient.
Okay, super. Okay, final question we have here is, can you take MitoPure intermittently, such as every other day, for example?
It's a good question, and one to which I don't think we have a clear answer to as of today, because the way I see it is that, or at least our trials have been designed, is to take it regularly to track compliance. That's how you know in randomized trials of 4 months that your product is having an effect. Now,
Well, we also know the half-life, right?
we know the half-life. The half-life is around a day, so we know after a day the levels of will go down, and so you would not stimulate as much mitophagy or biogenesis down the road. So that's one of the reasons why we stick to a daily dose every day. Now, think of this like, again, I'm not saying this is exercise in a pill or anything like this, but you need to have regular exercise over X amount of time to get the true benefits of exercise. And if you stop doing exercise, you can't just say, oh, I exercise for 2 months and now I'll have health benefits all my life. So think of this in a similar pattern, that you need to be taking this regularly and for a certain amount of time to have the health benefits associated with it.
Okay, super. Well, with that, Dr. Singh, we're coming to the end.
Yeah.
So thank you very much. And thank you
Pleasure,
everyone
as
for
always.
joining
Thank
us.
you for the
And
questions.
we'll have another one of these this coming Thursday, 9 a.m. Pacific time. So same time on Thursday. If you have any questions, please make sure you send those through ahead of time, and we'll make sure we answer as many as we can also in a follow-up email. Thank you so much, folks.
Thank you.